And we've moved into public health, and I kind of assume that what will happen is that we'll really focus on a neighbourhood community type approach. But I think that there is a danger if we begin to do that, that those complexities that Michaela talked about, and kind of about the political and funding issues that are above us, will absolutely get lost. It feels like we don't have any teeth, like we don't have any power. It feels like a big parallel process at the moment for me. The parallel process of we're talking about potential powerlessness in addiction, and then actually powerlessness in providing services to people who are experiencing addiction. I'm one of those services that I'm currently working in a service that might get closed down. It's very new, it's very young, it hasn't really got a massive evidence base, but there is evidence abroad to say that this particular type of service works. But in this country right now, it's not necessarily something that's looked on as important. And I think for me, I've grown up in a community that was absolutely completely ravaged by addiction and alcoholism. There wasn't anybody in my street and in the surrounding neighbourhood that didn't either have somebody in their family who died through addiction or alcoholism, or who knew someone who had died through addiction or alcoholism in their own family, or in the close neighbourhood. And for us, knowing that, we felt back then there was nowhere to turn, absolutely nowhere to turn, that there was no one who could help the community. And I think what we're seeing now is communities beginning to help themselves. And whilst I am a kind of big fan of the community development approach to addiction and alcoholism, I'm also concerned that it's currently potentially going to be used as a way to cut funding. So instead of it being invested in and saying this is a fantastic approach through public health approaches, down to neighbourhood levels, let's invest in this method. It's a modality that clearly works. We've seen it work in the States, we've seen it work in other areas. But I actually think potentially it may be used as a smokescreen in order to cut funding and to say actually you can do it way cheaper. And I think ultimately, as our friend from CRI said, about no matter where we end up, whether we're in public health or the MOD, the field that I'm working in at the moment, I actually wouldn't mind if the MOD took the money, but nonetheless. In some ways, it doesn't matter where we work, we just have to get our head down and do the business, really. Ultimately, we have to focus down and do what we need to do. It's also with the Changemakers. You know, Michaela said she might be accused of not understanding the complexities. I don't understand the complexities. I've got to the point where I'm not asked anymore. I'm not asked what's going on there. What I'm asked about is trying to do the right thing for people, making sure that people are respected, that people are loved and cared about, that we remain curious about people at all times, that we keep being curious about the human condition, not just about addiction and alcoholism, but everything that comes with that, everything that comes with poverty, marginalisation, isolation, separation. We know that connection and community work, not necessarily always prescription. And I think if we're going to go down the public health model, I think we really need to start prescribing community connection and belonging to people, really. Let's have that written out on a prescription. I went on public health website this morning, completely blurry-eyed at 6 o'clock this morning, thought, oh, look, I'm supposed to be speaking about this, best know what I'm talking about. And there on the website is just also, there's like 5 different stories about Ebola, and then another story about cold weather, elderly people in cold weather. And so I just wondered where we were tucked away in there. Where's addiction and alcoholism? Where is substance misuse? Where is it? Really, I think I would have to go digging to look for that, really. I think we'd probably be hidden away. And really what we need to do is to be out there and be visible, and to start saying, actually, there are things that we can do as a community that can really shift the landscape at the moment, and particularly with the general election coming up. I can't even say how frightened I am about the future with this particular general election coming up. Yeah, I think ultimately it's all about kind of staying where we are, hopefully staying where we are in public health, making sure that commissioning arrangements are tidied up a bit more, because that's going to be difficult. We're not just all commissioned under public health, that's where the needs of the people that we work with are based in, but we're not necessarily all going to be commissioned from there. And so I don't want us to return to the days of the old regional health authorities and the district health authorities, where we've got different contracts with different organisations. And at the same time, I also don't want to enter those tender and procurement processes where the big boys fly in and just trash all the people who've been on the ground doing real fantastic community development work and recovery work in this field for a long time. So I'd say we really need to potentially stay where we are, but ultimately wherever we go, we've just got to get our heads down and do the business.